Yes, is it full screen?
സ്ക്രീൻ ആയിട്ടില്ല.
Yeah, ma'am.
Can we start?
Yes, yes, sure.
Okay.
Good evening, respected guests, professional and student EXCO members, RAS SB leads, and dear attendees. Good evening to all. We hope you all are safe and wish to stay safe and healthy. Before we start off with the program, I would like to request all the attendees to stay with us till the photo session at the end. IEEE RAS Kerala chapter welcomes you all to the fourth session of RALS, Robotics and Automation Leaders Symposium. I now invite Professor Sandhya L., Secretary IEEE RAS Kerala chapter, to deliver the welcome address.
Hello, am I audible?
Yes, ma'am.
Okay. Good evening, all. Hope all are staying safe and healthy. IEEE RAS Kerala chapter is very happy to welcome you all to the fourth edition of RALS Robotics and Automation Leader Symposium. Our topic for the day is Healthbotics. Isn't it high time to coin this new term? On behalf of the entire RAS team, I would like to welcome the speaker for the day, Engineer Jayakrishnan, who is the founder and CEO of Asimov Robotics Private Limited, a company that provides engineering solutions and consultancy in advanced robotics and AI. Asimov Robotics has been featured in Forbes magazine as one of the most promising companies in the field of AI and robotics. Mr. Jayakrishnan started his career in Grantil Technologies as an embedded system engineer. He was also a senior specialist at Tata Elxsi, where he led a research project on inertial navigation system design based on MEMS sensors for Epson Robotics, Japan. I would all welcome the participants without whom this session wouldn't be possible. Hope you have an enlightening session today. Hope to meet you for the future events of RAS Kerala section. Last but not the least, I extend a hearty welcome to the Exicom members and the student leaders team. I now hand over the mic to Mr. Jayakrishnan. Sir?
I think JK has left the meeting.
It's not there. Maybe some net issue.
He's joined. JK? Yes, yes.
Yeah. Yeah, sorry about
So you
the
can please start.
network issue. Yeah.
Yes, sir.
Now I'm to my hotspot. Hopefully this is fine. And if anything you want to communicate to me, please don't call me. Please WhatsApp, send a WhatsApp message or
Okay,
WhatsApp call.
okay, okay.
I think the screen sharing has gone now, right?
Yeah, it's lost.
Is it there now?
Not yet come. Yes, yes, it's come. Yes, it's perfect.
So let's start. So in today's session, we will be mainly discussing the various applications of robotics in healthcare. So the entire presentation, the treatment will be in terms of the opportunities and the possibilities and the challenges in this field. So I hope that the listeners will be able to get an understanding of this particular domain, and that would be help if anybody is interested to shape up their career in this field. Any questions, if technical, after the presentation? Because I'm not getting too much into the technical aspects in this talk. So as the title of this presentation, Healthbotics, is in the high time to coin this new term. is just put there for to generate an interest on this particular terminology. If you search, you won't be able to find this. It hasn't become a terminology, but if you go through the upcoming slides, you will be able to understand this is going to be very relevant, and how big is the opportunity, how big is this market, how big is the possible use cases, which makes this title meaningful. Can you see the second slide?
Yes.
Just to make sure that it is moving. If you look at India, you can see that our country has got a big deficit of healthcare professionals and facilities, particularly post-pandemic. If you look at the number of people who are passing out per year and compared to the requirement, it is only up to 20 to 25%. So currently, we have around 1.5 lakhs physicians coming out of college, and 3.2 lakhs nurses, and only 10,000 radiologists. We expected to have at least 5 lakhs ICU beds and corresponding number of ventilators in the coming year. But currently, we have only 70,000 ICU beds available in the country altogether. So the situation is not better outside India, more or less follows the same equation. So if you just look at the various applications of healthcare robotics, how can this technology be helpful in the medical field? It starts with the consultation. Obviously, if you have a problem, if you have a healthcare issue, primarily this is what you are going to do. So to start with the consultation, and then you have to diagnose the disease or the state of illness. And then you need a lot of skilled professionals to perform the consultation, or to do the treatment, or to provide the care. So that training is one important thing. You know that you cannot have people straight out of college put to use for this purpose. So that is also important. And obviously, you have to undergo medication, whatever kind of branch of healthcare, like it can be modern medicine, or it can be Ayurveda, or it can be homeopathy, or any kind of. There is a certain level of medication required. So how the technology can help medication, and of course surgery. Surgery, it is said that in the coming years, most of the hospital will be having intensive care unit, and only operation theaters, because the general health care is available at your fingertips, or through your wearable, wherever you're sitting, it is available. So other one is rehabilitation therapy. So and that is actually in many cases it is like after surgery, or after you have any kind of mobility issues, you have to undergo rehabilitation therapy. It's a long-term procedure. And caregiving, of course. Caregiving is also a long-term procedure, particularly for chronic illness, or sick, elderly people or disabled people. This has to be there in place. So how technology can help, we can look at. And the medical logistics. There are a lot of other, just like any other vertical, medical and healthcare field also has got a lot of requirements in terms of logistics. So that is a very potential area where robotics can help out. And lately, the pandemic, the issues that the pandemic has brought into our world, which has completely devastated our day-to-day life and redefined. So how to follow the new normals, that also we will look at. So the market size is really huge. It is said that by 2025, the AI market itself is 26.6, and the robotics market is 12.7 billion USD. So there will be an overlap, but this is available statistics now. So we'll start with telemedicine and telerobotic consultation. As you know, this is a very potential use case as in the country or our world is lacking in a number of physicians. It is important to make the expertise and experience available, not just limited to locally, but anywhere where you are sitting. So you can use robots for this purpose, which typically is a mobile base, and then it can be controlled from distance. And you can have camera, you can have a display for the patient to see the doctor or the physician, and it can have a very minimalistic diagnostics devices, including temperature measurement and oxygen levels based on the requirements. So this is a very popular use case, and another important need for this is to have if in case of a collective decision has to be taken. Say, for example, if a serious surgery is going on, you need to have a presence of an expert sitting halfway around the world. You can just make use of this kind of facilities to enable that. And this is another area where AI can help out. This is nothing but predictive diagnostics, because you know that the treatment becomes effective only when the disease or the health issue is identified as early as possible. So that helps them to, the physicians to provide appropriate treatment in time. And this also helps the patient to have faster recovery and less damage of organs if fatality is affected to any of these organs. And then it is how it is done using AI is like you may have to have a model, and then you may have to get a lot of data of similar diseases from patients from the past cases. Like the historical data is collected, and they have to train the model, and then you have to subject the current case under consideration. And then you should be able to identify. It is not only limited to the, related to the general data which is available from a range of, from various patients in the past, but also related to the, in certain diseases, it's also related to the data, personal data of this particular patient. So this is a very complex model, and it has to get trained. And most of the life-threatening diseases like cancer and many autoimmune diseases, which is typically based on your cell memory, so which has to be identified as early as possible. So some of them are image-based, and some of them are other parameter-based. Anyway, this is one of the potential use cases that AI is currently being used, and there is a huge scope in the coming years. This is something like a personal medication. Why it is called as personal medication is that so far, if you look at the treatment methodology, you know that long back, when you go to a hospital many decades back, they usually provide you some kind of suspension, some kind of medicine, which is very common to most of the diseases. Even for fever, stomach ache or anything, there were some common medicines. But as years passed, the medical science has evolved, and the cause of this illness is identified, and correspondingly the medication is also changing a lot. So now it is there is a wide range of medications for a single ailment itself is available. Apart from that, the current issue is that each individual is different, so you cannot that he or she, if subjected to this medication, will have the same result if it is done with any other individual. So the individual, the genomics or the genetic characteristics of the individual is also have to be considered while you prescribe the medication as well as its dosage. So this is typically called as pharmacogenomics, for which actually now the studies are highly supported by the use of AI, because that is also very much related to the data related to this patient, and then to identify from a pool of medication AI is successfully used. This is a very, what is it called, upcoming, very promising branch of study. My screen is not moving, I don't know why. 1 second. Okay, are you seeing this, the new slide? Nanomedicine?
Yes, yes.
Oh, okay, thank you. So this nanomedicine is an area where, you again making the treatment, particularly the modern medicine treatment methodologies, medications, and diagnostics more effective. Why? Because earlier, again, if you look at the medication, if I take the case of oncology, this chemotherapy is usually done for the entire body. So along with the problem tissues and the cancer cells, some useful cells are also being attacked. It is very common. You know that you have hair loss and you have many other problems when you undergo chemotherapy. So by using nanobots, you can not only do the precise diagnostics. Diagnostics, you have capsules now, which are robots actually moving through the, in case if you have a digestive issue, you can send robots. Just like you are performing endoscopy, you can send this capsule shaped robot inside and then identify what is wrong in the digestive system. So, and just like that, now very detailed and precise investigation is possible with the help of robots, nanorobots, and also treatment like targeted drug delivery is possible, which is typically addressing the specific cells or the group of cells which are having problem, and the medicine is delivered exactly at that point. There are some drawbacks also for this, something which is called BBB, brain-blood barrier, blood-brain barrier. So this is there is a epithelial cell between the typical blood, what is it called, the bloodstream, and then the neuro cells, which is a semi-permeable membrane, which these nanorobots can penetrate and then apply medications there. At times, body has this feature to prevent the toxic substance getting into the neural system. So this is sometimes can be a problem, but if you look at compare the advantage and disadvantage, you know that the advantage is much higher. And this is a very progressing area of robotics application in medicine. Next is robotics surgery. Robotics surgery, as you know, now there are different types of surgeries. Maybe I would say the first step of robotization of the surgery is one type of approach is to making it minimally invasive, because that there are a lot of robotic surgical systems. I don't know how much are there into practice, but this one popular one is, of course, the Intuitive Surgical's Da Vinci robot, which is a multi-limb robot manipulator getting collaborated inside the human body by entering through minimally invasive openings. So you can perform very complex surgeries with the help of this system, and you won't be having, your recovery time is much faster. You won't be having aesthetic problems like big scars on your body due to the cut, in case if it was an open surgery. And also what's like it is very much able to manipulate these robotic systems and perform very complex procedures much better compared to the situation if it was done completely manually. So first it has to be laparoscopic, and then only this kind of robots can be used. In some other cases, you deploy the robot inside the human body and it performs the surgery. Actually, in Asimov, we are currently developing a project for performing the craniotomy. That is a surgery performed to fix the problem due to the premature suture fusion. Your skull is actually multiple sutures when you are born. So if premature suture fusion is happening, you have to dissect these sutures. You have to keep it separate, because typically it is like your brain growth should be higher than the skull growth, is higher than the skull growth until the age of 1.5 years. At that time, if the skull is fused, if the sutures are fused, then you have a problem. It will restrict the brain growth, and you have an aesthetic problem also if it is unilateral. If bilateral, you won't be able to identify because it is symmetric. So this is a problem which was typically addressed with the help of open surgery, where a lot of blood loss is there, and typically this surgery is performed on young babies under the age of 1 year or 1.5 years. So then the blood loss is very critical. So this surgery, we are trying to make it minimally invasive. And there are other surgical systems, which are really helpful for the surgeons to perform the surgery. There are cases like experienced surgeons above the age of 50 years, 60 years, if they are still performing surgery, they have a huge experience and knowledge, but their hand stability and the ability to reach around the obstacles and the part under surgery is very much limited. Typically, their hand stability is an issue. So in that case, I have seen that surgeons performing surgery by resting their hand on stomach, on their belly, to get stabilized. So this can be supported with the help of stability assistive systems, platforms. I can give you an example. Like you might have seen cameras. There are a lot of anti-gravity platforms on which cameras are mounted. Nowadays, very popular. A lot of people are using that. Stable platforms. Just like that, you can use stable platform to perform surgery. We are also working with a project like that for laparoscopic neurosurgery. That is a compliant platform, because the laparoscopic neurosurgery, particularly the neurosurgery, is happening in a very small area, like sub centimeter space. So where the operation, the surgery procedures are very precise. So then when you perform this neurosurgery, you have to keep the adapter through which you are inserting the probe very steady. So you need multiple people. So this platform actually, and then working space a lot. If a lot of people are crowded around the patient, then the working space is limited. So this, one second. Is it audible there? Is there any problem? Because I'm getting message. I just talk. All right. So this system helps to minimize a number of assistants or junior surgeons, or those who are not actively into the surgery, and perform the surgery with a lot of ease. In situation, this is also good to minimize in performing a surgical procedure. Is it audible there? I just want to make sure.
Yes.
Hello? Oh, okay. There are also systems like microscopes. Now with 4K and 8K cameras, you can have microscopes to enlarge the body part under surgery. So you can mount systems. There are systems huge, which is again eating up the space, workspace, and very costly, about 4.5 CR typical cost. So you can, by introducing this 4K 80 cameras at the tip of a robot arm, you can again make a really good system for getting a better visibility of the body part and surgery. And then coming to the training systems, as I told, we have to reduce the time required for training the professionals. So in the picture, what you're seeing is that this is a typical case of regional anesthesia. And you know that this is a very, 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 what is it like, a job which requires a lot of experience. It has to be done very carefully. If a small change in the dosage and change in the position and change in the inclination of the needle, or even the depth of penetration, can be critical. Like he may not come back from come back to the consciousness sometimes. So this is trained typically by just by looking at it, understanding it. You cannot take any chance. So that is why these guys are being paid at very high rates. Like, you know, their salary is very high. Their experts are very less in numbers. So this the problem is that it takes a long time to get them trained. So this system is typically using a 3D reconstructed image, a 3D model, as well as reconstructed image, what is it like, fused together. And also there is a multi-body simulation which is running in the backend, which gives you the accurate tissue responses. This is true for any haptical systems, surgery training systems, that you need to get the the tissue responses. If it is a soft tissue or a hard tissue or a bond tissue, that has to be understood by you. So what it does is that, as you can see from the picture above, this is a completely different surgery. It's not anesthesia. In case of such a training system, when the person who has to get trained using that is basically catching the end effector, is catching, and now we can see that two phantom systems are coupled. Those are actually haptic feedback, devices or manipulator kind of thing, which can give you the force back. So you are looking at the screen, or you are wearing 3D glass, and you are looking at the part, and then you actually perform this anesthesia or whatever surgery you are performing, and then you can experience the force, you can experience the tissue responses at your hand. If you make a cut, in case of surgery, you can see that consistency of tissue at your hand. So just like that, the system also has got an analytics by which it will grade your performance. It will tell you when it is gone wrong, and it has a lot of corrective directions or measures by which this surgeon, junior surgeon can get, or anesthesia specialist can get trained. So this is very useful, and this is also used for examinations like intimate examinations, where you won't get a specimen. And there are other systems like I won't call it as training systems, systems like something which is used for treatment, like draining of the extra brain fluid. This is for a problem called hydrocephalus, where it's a by birth problem, where your brain, that your brain is in a pool, in a fluid. So that is normally drained off naturally. But if it is not done, your size of the skull will be enlarged. You might have seen such cases in real life. So the treatment is nothing but draining of the extra fluid. So this is done by inserting stent inside. Each person's skull geometry is different, but the medical textbooks, good old textbooks are talking about a fixed geometry, but it is not the real case. So what is done is that you make an insertion, and then you insert this you make an incision, and then you insert this stent inside to drain of the extra fluid. You end up like, you may not be exactly putting it in the place where you want to put it. So you have to withdraw it, put it back again. During this process, a lot of useful tissues are being, neurons or brain tissues are being damaged. Patient actually does not know about this fact. So this is also something which what is it, like a 3D image with the support of stereotactic guidance, and then reconstruction of the actual geometry of this particular person's brain through what is it, like scanning, CAT scanning, and then perform this accurately. So this is also an assistive system. It's not a training system, but it can be trained if you have this model well in advance, and then the damage will be minimum. And now there are also systems like the, what is it, like 3D printing is there. You can print the part under surgery if it is a bone, and you can perform the surgery multiple times. So you can plan things very well. So there are a lot of training systems available like this, which is supported by augmented reality. Also, like there are 3D models, and if you are actually working on the actual human being, then it can be overlaid. But I don't know whether it is practiced. It's highly practiced in other areas, like in the automobile sector or and other sectors for service jobs. But in case of surgery, I'm not sure. But augmented reality is there for training alone in case of surgeries. And then another area is caregiving. Caregiving, as I told you, it's sorry about the typo I was mentioning here by 24 by. I was actually trying to mention 24/7. So it needs to take care of these patients or the elderly 24/7. And so if you want to actually do this, you may have to quit your job. So in the current family setup, you don't have enough resources or people available to take care of this, who are actually ideally sitting at home, and then or who are free to do this job. But it's not a pressing issue in India, but outside India, particularly due to demographics in Japan and in Western countries, in European countries, this is a pressing issue. So you can make use of robots for this purpose. So what it does is, like, they can serve food and medicine, and there is a typical routine which they have to follow in case of food and medication. If any other thing which they have to practice, robot can remind, and they can monitor the patient 24/7 and send crisis alert to the human caregiver or relative. And then they can also engage them. Most of the time, these people are lonely, and they're actually kind of they're living a completely different life, and they get it is very much required, as you know, to for the physical health. So these robots can engage them by going through news clips, and maybe singing a song or cracking a joke. So all these things are possible. So this is also an evolving branch of healthcare robotics. A lot of robots are being used. And there is a specific case under this, particularly for dementia. So dementia patients with dementia, memory loss. So there are a lot of methods to maintain the current, what is left out. So that can be reinforced, and the lost memory can be restored using leisure exercises, which this robot can take up, and prompting them. So they are not even able to perform their day-to-day activities, like just washing the hand or brushing the teeth. So these are all things, there are systems. I'm not just talking about single robot, individual robot performing this, but there are robotics or AI systems which can prompt or complement their activities while they are performing this. So that is another use case under caregiving. And when it comes to the medical logistics, in fact, this is a very potential area for robotics, just like other, sectors. In case of hospital, hospitalized in ICUs or maybe under general care, particularly in ICUs, post-surgical or post-treatment care, they need a lot of items to be consumed or sometimes their microbiological samples have to be sent to these laboratories for testing. So there will be a lot of movements from sometimes pharma to the ICU or pharma to theater or samples from ICU to laboratories. Like that, a lot of movements are there. So these are typically done with the help of medical runners. So you can make use of robots in this case for transporting these items, and you can minimize the number of unskilled people. These medical runners are not actually professionals. So you can also reduce the number of human movements inside ICU, which is not at all desirable because these patients under care are having very low level of immunity post-surgery or post-treatment. So this can be minimized. And this is not a simple job. You may have to blend the workflow of these robots with the human workflow. So you can make use of the AML for this purpose by collecting the data. So we, Asimov Robotics, also working on this by implementing such a group of robots. They are conceptualized as miniature or scaled down ambulances moving through the corridor of hospital with the samples or medicines, as I explained. And there are also use cases post-pandemic. And now, because of this pandemic, this requirement has become a very pressing issue. Requirement. And then because of pandemic, there are other use cases. There was actually. Now I don't know, because this one you can see on the left, that is SEVABOT, which we have deployed at government hospital for helping the healthcare staff. So earlier we spoke about patients, now we are talking about healthcare staff. So to minimize their exposure with the COVID positive patients. But these patients are asymptomatic patients, so they are able to take care of themselves. Now these patients are at home. So it is not a very pressing use case now. And also if you look at other use cases of logistics, like transportation of organs and other facility to remote places and villages, you have already seen that that's in Kerala. I think once in a while there is this kind of surgery transportation is happening. So the road traffic is very difficult to manage. So you can make use of drones for this purpose. So that is also a very potential use case under medical logistics. So now we'll just quickly go through some of the post-pandemic applications of AI and robotics. Some of them we already covered. This is a couple of robots we deployed for creating awareness in public places and workplaces. Now, it is not a pressing issue, but now there are issues like there are a lot of fake information is spreading about the COVID and its vaccination and medication, various things. So still, use case, not very potential, but can be there if at all, to educate general public about this health issue and the vaccination and many things. What actually typically there you can get from the WHO's websites. This is another thing in connection with maintaining the new normal. As you know, now in the coming years, we don't know when exactly this issue is pandemic is going to settle down. But till then, until it is completely settled down, you have to maintain the new normal by wearing the mask, keeping the social distancing, and you have to be back at home if you have any sort of illness or anything which is related to COVID or having COVID symptoms. So you can deploy robots or AI-based systems agents in public places to make sure that you don't have any such people stepping into your premise or workplace. So this is also we have robots which is taking care of this health screening. Most of our robots are actually equipped with this health screening. It's a very potential use case. And coming to this sanitization, environment hygiene, you know that because of COVID, you basically have to periodically clean and sanitize or disinfect your workplace. So this is typically called as lab area disinfection. You can use robots. We are actually working, we have released this robot. Cleaning and sanitization and then fumigation, various things can be performed with the help of these robots. This you have already seen, we have already discussed. And this is some of the pictures from the hospital. And this also you have seen already. And this is again, use case which we have patented. When Nipah outbreak was there, this is not just a robot, this is a robotized intensive care unit, where the entire healthcare systems and life-saving systems are connected through the robot. So you can have continuous surveillance, and you can adjust the bed height, bed inclination, drip speed, and everything will be monitored and then alerted to the caregiver sitting outside, and it will be always there. So typically for this, particularly like Nipah kind of life-threatening diseases, you generally don't want to be there. Like even physicians, even with PPE, don't want to be inside the ICU always. But if you deploy such robots and get it connected to all the life-saving systems, you can have 24/7. Even after during the recovery period, you can have these robots to be there to engage the patient and taking care of his requirements. So this robot actually does require many functionalities, like it has to self-disinfect because it has to come out. It has to come out of this zone and then collect food and then dispense there. So it has to perform the self-disinfection also. So it's a very interesting use case. We are working with it. And there are many other use cases. I was just about to type down because of time constraint. There are robotic implants like distractors and various other implants. And there are other implants like replacement for retina and then prosthetics like for amputees. A lot of implants and extension to human body is possible to make their life more comfortable and safe. So there is one use case I will just tell that in case of some people are born with disease. The length or the height, the length of the limbs are not in proportion with the standard human being. So that has to be extended. So there is a technology. There was a technology earlier which was very popular called Dr. Elisarov's ring fixator. This is like making cuts in the bone and then fixing the ring and extending it, gradually taking many months, like 3 months, 6 months, like that. Small separation you make, and that will be filled with naturally filled with bone tissues. Likewise, you can extend the length. So now this can be there for various bones and bone structures in the body. So you can use robotic systems. Separation can be increased periodically with the help of a mobile device. You yourself can do, or doctor can do from anywhere, wherever he is sitting, by looking at the progress. So this system gets connected through your body. So this is like typically a battery operated, just like what is it like this what you typically use for cardiac problems. I forgot that name. So
Pacemaker.
Pacemaker. Yeah, thank you. It is inside the human body, and then what it does is like there is a robotic system which is under the control of the physician, and also autonomously based on the history of these improvements. So it continuously adjusts this, and then until you have the limb got extended, and then you can, with the help of a surgery, you can remove that. And there are assistive systems like for muscle amplification for disabled people that can be used, and then rehabilitation therapy, which I didn't get much time to do this, but typically it is done with the help of systems which exerts different kind of resistance for the training for the patient under this treatment, and also compliances in different directions. So you can use a robotic arm with back drivability for this purpose. So the scope is endless. So with this, I am just concluding, and you can ask any questions. So, and both in terms of this opportunity as well as any technical questions, please feel free to ask.
Yeah, thank you, sir. Thank you for giving us such an informative session with a beautiful presentation. Now, let me hand over the session to Shruti for the Q&A session.
Guys, if you
You
have
can
any
unmute.
queries, you can post in the chat box or you can unmute and speak.
If somebody read through the chat box, it would be very helpful.
The participants, you can ask questions.
Yeah.
Yes, sir, we have a question.
Yeah, I saw that. The name Asimov. Asimov, basically, it is named after the fiction writer Isaac Asimov. And to defend the claim, we have an expansion, advanced systems with intelligence, mobility, and vision. If somebody comes and claiming this, we have this reasoning for that. Please read through the other questions. It will be helpful. It just disappeared. It came.
Yes, sir. Yes, sir. The first question is, what is behind the name Asimov?
Yeah, I replied that.
We have one more question. Are there any developments in microscopic robotics in the field of surgery?
What kind of robotics?
Microscopic robotics.
Yeah, as I already told you, there are a lot of development happening in this field. But all this development have to go through a series of approvals. So typically FDA approvals, CDC approvals are required. So it's a long-term process. But in India, last year or something, the policy has been amended. Some of the restrictions were lifted, and now it is possible to do some limited experiments. Typically, for surgery, we first do the cadaver surgery, which means that that is performed on dead bodies. But in case of this robots deployed, I don't think, because it typically make use of, it's a partially passive systems. We make use of, in case of if you want to send a robot through your digestive system, it might be making use of the peristaltic movement for the propagation. So dead bodies, it is not there as you know. So a lot of research is happening. If you make the question more specific, I can give you a specific answer.
Sir, one doubt.
Yeah. Read through the questions.
Am I audible?
You are audible.
Sir, while making products like you showed that mini ambulance sort of thing, what software does it use?
That is again, software is a very generic term. I expect you.
Like, is it using RAS or
Yeah.
like any what is like the control methods?
One second. Let me show you a video of that. I just forgot to show you. Can you see the screen? Can you see the screen?
Yes,
Yes,
yes.
sir, it's visible now.
COVID has devastated all facets of our life. Intensive care giving has become a nightmare, especially for the patients and the person. I'll show you that. 1 second. Give me a second. COVID has devastated all facets of our life. I'll find it out. You can. I'll just answer to your question. I need to find it out. Okay. So yeah. So your question was basically kind of what is the software? Yes, it is a multi-layered software. As you know, first what we have to do is to perform point-to-point navigation, right? So for that, I mean autonomous navigation. For that, uh, we are actually making use of sensor fusion. We have radar, proximity sensors. We have camera, and then we have indoor GPS. So using all these, we are performing autonomous navigation. On the top of that, what we do is it has to show a certain behavior. It should not be a hindrance for human workflow. So we collect information from again through these sensors, and then, for example, if there is a bed or a trolley coming from this theater, then we will robots will go into one side and then giving way to that. Just like that, various behaviors are there. So that is there, and on the go, it should improve its performance. So for that, we are actually collecting the details of this trajectory as well as the speed and the peak time of these movements by using passive RFID tags on these health workers or medical runners hands or body, and also we have containers with the passive RFID tags, and we track it. So each thing is taken not in the same fashion. Like some blood samples, they can take by taking time, but some other thing like medication or saline bottle is not carried in the same fashion. So we track it, and then on the go, we make the robot more intelligent to smoothly, seamlessly blend with the human workflow. So multi-layered software architecture.
Thank you, sir.
I'm just searching through. By that time, you can ask me.
I hope there are no session to others.
If I find, I will show, otherwise it is.
Thank you, Shruti. Before we move on to the conclusion of the event, I request all of you to just switch on your cameras so that we can have a quick snap to keep it as a beautiful memoir.
Done. Yeah.
Thank you all.
If you have time, I will show you a picture. I am not able to find this video. Otherwise, fine. Fine, it's fine.
You can show that.
Can you see the screen?
Yes.
Probably I cannot put this in web or anything. This is the robot. This is the video. Let me fast try.
I can go ahead.
Yeah, this is the video.
I will try to go there and then go. The door is open.
You can see that, right?
Yes.
So the robot goes with the sample and then it comes back with the report. Okay.
Now, let me invite Abdul Ahad, student representative, IEEE RAS Kerala chapter, to propose the vote of thanks. Abdul, please.
Our distinguished guest, Mr. Jayakrishnan sir, respected members of the RAS Expo, student dean, and my dear attendees, a warm good evening to all. It is my privilege today to be extending the vote of thanks for today's fourth session of Robotics and Automation Leaders Symposium. Guest, Jayakrishnan sir. Needless to say, it was our privilege to listen to a person of such vast experience and on a topic like medical robotics that is highly relevant in the present scenario. As a token of our gratitude and respect, we'd like to present you with a virtual memento. Kindly accept our gratitude. Once again, on behalf of everyone attending the session, we extend our biggest thanks and wishing you all the best on your future endeavors. Next, I thank the members. Thank you, sir. Next, I thank the members of the RAS Execom for coming up with such a wonderful session, wonderful and educative session for all of us assembled today. And finally, but very importantly, I thank all the student volunteers and the participants who have attended today's session and made it a huge success. On all of our future endeavors. And finally, once again, thank you all and hope you stay safe. Thank you.
With that comes the wrapping of the event. We wish all to find yourself safe and healthy. Stay connected with IEEE RAS Kerala chapter. Until we meet up again, good night all.
Thank you
Thank-
once to all of you. Thank you. Take care.
Thank you, sir.
Thank you, Jackie.